Hello, guys, and welcome to the lecture series on GI disorders. And in this video, I will talk about the inflammatory bowel disease. Actually, the inflammation to the bowel is called inflammatory bowel disease, and the inflammation could be due to many causes. That could be the direct mucosal injuries by the drugs, or that is not most common cause, but other most common cause genetic include the genetic predispositions and other causes I will talk further in this video. And what are you going to learn in this video? Actually, you will able to know what is IBD, and you will know that what is the Crohn disease and what is the ulcerative colitis, and the other that is between the Crohn's and the ulcerative disease, that is the indeterminate colitis. And you will also learn that what may be the etiology of the IBD and what is the possible pathophysiology of the IBD. In this video, you will learn the definition of the IBD. Actually, the definition of the IBD includes the intestinal conditions and in which there may be some idiopathic causes or some chronic, maybe some relapsing things could happen to the intestine, or some remitting inflammatory things like some things happened again like in the diarrhea or some other infections which have caused the inflammation to the intestine. And in the IBD, the gut's ability to digest food, absorb nutrition, and eliminate waste is disrupted, and due to which the patient may uh, exhibit with the symptoms of weight loss, or maybe some abdominal pain, or the other GI symptoms. And actually, we have two types of IBD, the Crohn's disease, and the other is the ulcerative colitis. And these two diseases of IBD are most common, and that involve the bowel. That could be the small bowel or large bowel. And actually, we should differentiate between the ulcerative colitis and the Crohn's disease. What is the ulcerative colitis? When we see that only the large intestine with the rectum is involved in a continuous pattern. Look at this picture. You see that this bowel, like the lower colon and rectum, is involved in the continuous pattern. That could be the possible manifestation of ulcerative colitis. And the inflammation uh, occurs only in the mucosa, like that is the innermost layer of the lining of the intestine. And usually, ulcerative colitis begins in the rectum and lower colon, as you see in this picture as a red color. And actually, sometimes we see that in ulcerative colitis, whole entire colon is involved. Like you just see that this is not continuously, this is not whole colon involved, but sometimes we see that whole colon involving the transfer in the ascending colon may be involved in the ulcerative colitis. And what is the Crohn's disease? Actually, the unlike the ulcerative colitis, in Crohn's disease we see the transmural inflammation. That means the entire thickness of the bowel wall of the mucosa is involved in the Crohn's disease. And we see that in Crohn's disease, any part of the GI tract may be affected. And look that it could also involve the small bowel like the jejunum, the ileum, or maybe colon. But you see that the Crohn's disease appearance of the bowel is in patches. Like you see it is not involving the continuously of the bowel, but you see the patch is like it has this skipping lesions that is totally normal. This is the appearance of the involvement of bowel in the Crohn's disease. And we see that in some individuals, it is difficult to determine is there IBD or like it is Crohn disease or ulcerative colitis. We name that thing the indeterminate colitis because we haven't determined either it could be the Crohn disease or ulcerative colitis. And what could be the possible etiology of the IBD? Actually, in some people, we see the genetic predisposition. They have the family history positive, in which the inflammation to the bowel have happened, and the immune system regulation could be affected, and we see there is no proper regulations of immune system in IBD, due to which the inflammation could occur to the mucosa, and the environmental triggers like the liminal bacteria, like when the bacteria is not like some bacteria could inhibit the mucosa, causing the inflammation. We see the infections by bacteria or virus, and the NSAIDs or the smoking. These may be the triggers of the uh, mucosal inflammation. The other causes could be that some people take fat or fast foods and the milk or the fiber consumptions that are heavy foods and could cause inflammation to the mucosa by many mechanisms. And the two most important infections, like the Mycobacterium paratuberculosis, causes the Crohn disease, and the infective diarrhea after many episodes causes the ulcerative colitis. We see that the patient had the diarrhea, and that could be causing ulcerative colitis. And we see that the GI flora, like that is mostly dominated by bacteria, but it also includes the viruses, the fungi, or the protozoa, and these are most important. But during IBD, these are most important for the host immune system, and the host immune system is dysregulated by these things when inflammation occurs to the IBD. And the composition of the intestinal microbiota appears to be altered during disease, like there will be no normal macrobiota of the intestine, and that is disrupted during the inflammation. So other, like we see the what are the factors of genetics, we see that HLA linkage or some first degree relatives are more prone, and mostly the monozygotic twins are mostly prone to the IBD. We see that means 40% more chances to get IBD if you are a smoker. And some people who had appendectomy, they may have the IBD, and some stress may cause the IBD, because we see that gut brain microbiota, that could be the cause, and that is due to stress. And uh, what we can see that what could be the pathophysiology of the IBD? Actually, some triggering events, like you see here, the environmental factors, some dysregulated immune response, or host genetics could be the triggering uh, factors, and they just dysregulate the inflammatory and immune response in genetically susceptible persons. And when there is amplification of immune response, they actually release the inflammatory mediators that could be the macrophages, the neutrophils, and like others, the TNF alpha, the pro-inflammatory interleukins, and these just break down the mucosa, and there is continuous exposure to lumen dietary or bacterial antigens that are causing the inflammation and break down the mucosa, and they impair the handling of microbial antigens by the immune system that cause the dysregulated immune system to have more inflammation to the mucosa. And at the end, we have the inflammation to the bowel that you just look at how caused the bowel system to have inflammation because of many factors, and what are differences between the pathophysiology of ulcerative colitis and the Crohn's disease. We see that in ulcerative colitis, the inflammation uh, occurs in a pattern that there is loss of fine vasculature pattern. We don't have the vasculature uh, pattern in the UC when there is inflammation, and there is increased mucosal friability, and the ulcerations, you see the exudates or maybe pseudo polyps may be present in the UC, and there is ulcerative colitis. And in the Crohn disease, you see the skip lesions, and there is inflammation, plus there is subsequent injury of the tissues like the cryptitis. That is the typical name we give to the CD. And the crypt abscess, influx plus epithelial necrosis may be present during the inflammation in CD, and there is focal epithelial ulceration to the mucosa, and we see that influx and proliferation of inflammatory mediators may be present in the Crohn disease. And at the end, you see that there is transmural inflammation to the mucosa, and we just diagnose that the patient has the Crohn disease in that case. And we may have the lymphedema and bowel wall thickening in CD as well. And we name that disease Crohn disease. Thank you for your attention.